Hello, everyone. I am Beatrice. Thanks so much for joining us today. I am your guest host for this special joint webinar by No Silver Bullet for PD and the PD Buddy app titled Women's Health and Parkinson's. Just a quick reminder, this session is for informational and educational purposes only. If you are seeking personal medical advice, please speak to your healthcare professional. For those of you who are new to us, No Silver Bullet for PD is a Parkinson's support group with a fantastic YouTube channel that hosts monthly expert webinars. And PD Buddy is a free, easy-to-use app designed to help people with Parkinson's take control of their day-to-day life. Today, I am delighted to introduce Dr. Tanya Denne, a naturopathic doctor who specializes in women's health and Parkinson's. Dr. Denne takes a whole person approach to care, blending evidence-based natural therapies with modern medicine to help bridge the often overlooked gaps between specialists. She works closely with women navigating Parkinson's alongside hormonal changes and helps optimize nutrition, gut health, sleep, and overall well-being. Please do pop your questions into the Q&A section, and we will do our best to answer them after Tanya's presentation. Tanya, over to you.
Wonderful. Let me share my screen, and hopefully you can see that. Is it in presentation mode?
Yep, all great.
Okay, perfect. All right, I want to thank PD Buddy and No Silver Bullet for your contributions to the field in Parkinson's first and foremost today. I'm happy to be here to discuss some topics I'm really passionate about. So today on the agenda, we are going to be discussing perimenopause and menopause, and I'm kind of going to use those terms interchangeably. We're going to discuss hormones and its relation to Parkinson's, the use of HRT, which is defined as hormone replacement therapy. And we will be discussing the hypothalamic pituitary axis and the HPO axis. We will be discussing the GUS, which is the genitourinary syndrome of menopause, and all things listed. Some of the labs and blood work that I recommend and use often are third-party esoteric labs that I'll bring up, such as the Dutch test and GI map. So my goal is for women to optimize their Parkinson's symptoms and the perimenopause symptoms. My hope is that you leave today feeling more empowered and have more information for your personal healthcare providers. You can reach out to me for consulting work, and I suggest you follow up with your neurologists and gynecologists with specific and appropriate questions. So the disclaimer is, again, this is not medical advice. Please work closely with your neurologist, internist, ND, or call for recommendations. But we want to discuss today a lens, like an overarching things that I'm passionate about in integrative medicine and whole person care, with a focus on what women are going through in their peri and menopause journey. These are often topics I address with patients. These are the tenets of health that I discuss each visit with my patients. And this is just a little bit about my background slide. As a clinician and researcher, I've been involved in the Parkinson's world since 2010 with Oregon Health and Science University, a pre and post medical school. I'm now in private practice here in Southern California and working on a nonprofit Parkinson's startup. So I view Parkinson's as a syndrome, and Parkinson's is very complex. It's a multifactorial, so are our hormones. Hormones affect all of our organs, from our ovaries to we have estrogen receptors all over our bodies, in our hearts and in our brains. There is a hormonal balance, and it's essential for women's health and emotional and life cycle. So hormones orchestrate a complex and interconnected aspects of our physiology, which unfortunately, if they're unbalanced, they can lead to dysfunction. This is especially important in Parkinson's diagnosis and with women to discuss these interconnections. So in perimenopause testing, women can spend approximately up to 12 years in perimenopause. Menopause is essentially just one day. By definition, is a lack of menses for 12 months. However, there's a time span of transition that we need to support women's hormones and balance their Parkinson's diagnosis and hormones, and be potentially treating Parkinson's a little bit differently, especially in these premenstrual periods. So before your menses, women notice an increase in their symptoms, especially fatigue, UTIs, the genitourinary symptoms we were discussing, bradykinesia, and tremor. Menopause is inevitable. We will spend approximately 1/3 of our lives in menopause. So it would be great if we can understand it and we can work closely with our trusted providers to discuss and know more. I like to run labs. So I like to have an informed approach on how and where a woman is at in her cycle and perimenopause, menopause journey. I do this through cortisol, blood work testing, Dutch testing, serum labs, looking at the hormones on blood analysis. So this matters because it affects women in the workplace. 2023 survey in the UK actually suggested of over 2,000 women were surveyed ages 40 to 60, and 23% were considering resigning due to the impacts of menopause, and 14% said they actually planned on handing in their resignation notice due to symptoms. So this is really important because this is often when women are considered the wisdom years for women. It's a time when the kids are actually grown and women have some time to lean back into their careers and jobs and roles of leadership. They've acquired a lot of their knowledge and skills to share and then mentor. In 2002, the WHI, which stands for the Women's Health Initiative study, came out. And unfortunately, HRT and estrogen was widely vilified through this study. It led to a lot of fear and misconceptions in the role of health and estrogen and HRT options for women. Many providers just stopped prescribing. And unfortunately, the study had flaws. Estrogen was given to women without a uterus, without progesterone. We know that we do not give estrogen unopposed to women with a uterus without progesterone, or else we risk the increase in hormone-sensitive cancers and hyperplasia. So the timing of HRT does matter. We know that there is this window for HRT to be best administered, and it's typically within the first 5 years of a menopause diagnosis. Some differential diagnoses that I like to discuss for women who are in the perimenopause and Parkinson's diagnosis, especially fatigue, because there's so much overlap, and this is a major symptom of Parkinson's and menopause. So we need to differentiate. We need to differentiate so we can address the root cause of fatigue for women. A lot of times this could have to do with iron deficiency anemia. I often see low ferritin, which can be resulting in hair loss, low energy. It can stem from an H. pylori infection. I also screen for high ferritin, which is a marker for, we call it an acute phase protein. It's a signal for high inflammation, such as blood markers that you might be aware of, like an hsCRP, CRP, ESR. I analyze CMP, CBCs to rule out and differentiate causes that women might be discussing around heart palpitations, shortness of breath, pale skin, cold extremities, dizziness, headaches, tachycardia. These are a lot of overlapping symptoms, so we want to discuss root cause. I analyze blood sugar management in all of my patients and screening for diabetes. I check fasting glucose, A1C, insulin, and an IR, which is an insulin resistance panel, often ordered through Quest Diagnostics. I also have and like to stress that there's different functional lab ranges that I like to set goals for. I check for cortisol imbalances. Cortisol is a diurnal hormone. It often fluctuates differently in response to melatonin, which is one of our sleep-wake cycles. So this can be contributing to weight gain for women, fatigue, insomnia. I check what we call a CAR, which is a cortisol awakening response. That's on a Dutch test when appropriate. That's actually a 4-point urinary analysis throughout the day. I screen for sleep apnea. This is very important, common in Parkinson's and REM behavior sleep disorder. I also screen for hypothyroidism, discussing cold intolerances, weight gain, which is overlap in menopause as well. Women often discuss that as a symptom. I check for antibodies for autoimmune thyroiditis, so further screening for the thyroid, such as Hashimoto's. I always screen for thyroid function tests and antibodies at least once with my patients. However, I do discuss that this is autoimmune, and autoimmune pathways can be triggered at any point in life. They can come and go. I screen for hyperthyroidism, which is less common, but we still want to check this for some of the symptoms would be weight loss, diarrhea, tachycardia, goiter, heat intolerance. A survey that was conducted in the Netherlands in 2023 found that 2/3 of women diagnosed with Parkinson's reported a worsening of their Parkinson's symptoms after menopause. The most frequently reported issues were this fatigue, urinary tract problems, very close second, and a decline in the effectiveness of their Parkinson's medications. This was very specifically kind of pinpointed right around the time before menses and varies for women, though, over the cycle. Specific Parkinson's symptoms that worsened included bradykinesia in 23% and tremor of 19%. I use an integrative lens working with my Parkinson's patients, an approach to treat the whole person and knowing that all these systems affect their Parkinson's and menopause and possibly the rate of progression. These are very common labs that I will run with women. They help me differentiate what symptoms are Parkinson's and what symptoms are likely peri or menopause. And that way can be helpful in identifying the etiology, again, here so we can address the root cause. I use different functional lab reference ranges than the lab ranges reported often by insurance companies or on your lab reports. Unfortunately, a lot of industry standards for lab ranges are based off the general population. And we know actually that there's kind of a representative unhealthy level in our general population. And so I want to aim to be preventatively aggressive actually on these labs with nutritional deficiencies, glucose control, and inflammatory markers. I want to be looking for the problem before there is a problem and addressing these coals and embers and not wait for the house to be on fire before we intervene with a treatment plan based off of the blood work. So as of April 16th, this study just came out discussing perimenopause tracking. There's a new, we call it the small density LDL cholesterol marker. I actually fractionate cholesterol panels with all my patients, especially women. I've been running these for years with patients because we know that cholesterol can increase during perimenopause and menopause, and this actually starts as young as women in their 30s and 40s. And I see this all the time, actually, women that are frustrated and worried. I see it on their blood work. And I hear, I haven't changed anything. Why is my LDL and my cardiovascular risk increasing? Unfortunately, declining hormones and perimenopause could likely be the answer. And this is a kind of a typical blood panel that I will run with people. HRT is useful in addressing a lot of these symptoms that we've been discussing about regarding hot flashes, sleep, anxiety, painful intercourse, vaginal dryness, migraines with headaches that fluctuate with the menses. So these can be due to fluctuating levels of estrogen and progesterone. We know that no unopposed estrogen prescription in a female with a uterus. However, research shows that HRT and progesterone does actually not increase the risk of breast cancer in the first 5 years. So, a study in 2018 publishing on the safety. HRT is contraindicated, though, with women who have undiagnosed genital bleeding, history or suspected breast cancer, estrogen dependent neoplasms, acute liver disease, abnormal function tests of liver, history or recurrent VTE, which is a venous thromboembolism, or known thrombophilia disorders. So typical HRT prescriptions could include, there's oral patches, topical estrogen, vaginal estrogen, I often like patches because we're bypassing first pass metabolism, which has to do with our liver. So they're genuinely safer. And topical or oral estrogen and progesterone, a typical dose for progesterone would be 100 milligrams to 200 milligrams at bedtime, screening for peanut allergies here, and those can be helpful for sleep. So we discussed the loss of estrogen and progesterone. Perimenopause HRT can typically consist of progesterone alone. That's our first. Progesterone starts to decline in perimenopause sooner than estrogen. So the decline can actually start in a woman's 30s. Progesterone supplementation can be transdermal, 20 milligrams per milliliter at night, applied to the skin. And this can also be useful in the second half of the cycle, days 14 to 28, to support the menses. And this progesterone also has similar contraindications as estrogen HRT. So we want to know and screen for those. DHEA, another hormone, starts to decline around 25 years of age. So this is even sooner. DHEA is also a precursor which can be converted biochemically to testosterone and or estrogen. I often supplement this with patients, especially women. DHEA is our hormone of stress and resiliency. The goal for labs is, for me, I like to see it around over 100 micrograms per deciliter of blood. And it can range from 75 to 400, though, involved in functional testing. DHEA is involved in androgen deficiency, which are symptoms such as low libido, low mood, and insulin resistance, actually. So testosterone is another key hormone we discuss. It is helpful for lean body mass and retaining muscle mass, which we know is really important in Parkinson's patients, especially women, and bone health and osteoporosis. So screening for testosterone levels, and there's also HRT when it comes to testosterone replacement. And libido has to do with testosterone levels. We're screening here again for cardiovascular health and energy. I like to discuss especially the genitourinary symptoms of menopause with patients because this is very common. Common symptoms are pain with intercourse, dryness, an increase in urinary frequency and urgency, and an increase in UTIs due to a decrease in estrogen and a decrease in collagen. So the vaginal mucosa diminishes as we age and leads to a decrease in orgasms and also the microflora. So we see a decrease in the vaginal microbiome as well as changes in the pH. This decrease in the vaginal mucosa results in a decrease in the lactobacilli bacteria, which is a species that helps maintain the lactic acid balance. And unfortunately, this results in an increase in UTIs, and the thinning of the vaginal walls can increase in pain. A treatment I find helpful for women are these DHEA inserts and estrogen inserts. And there's also just hydration inserts that have no hormones in them at all. Probiotics and D-mannose are often useful for women. I just make sure always to screen a UA urinary analysis to rule out infection first and foremost. We can then go on to discuss some of these vaginal suppositories for UTIs, libido, intercourse, yeast infections. Estrogen promotes the growth of lactobacilli, so stimulating of that glycogen in the mucosa. Some of these vaginal supplements have estriol, which is the weaker form of estrogen, and it works to increase the collagen in the skin, and it helps with the dryness and itching seen and relief from these UTIs, and decreases the dryness, decreases vaginal atrophy, helpful for this pain during intercourse, and helpful for restoring the vaginal flora. I often use D-mannose. It can be very helpful for both men and women in preventing UTIs, actually. So this is one of the nice things that we can use preventatively. The long-term data on estriol, that estriol's intravaginal treatments are safe and do not present with the same endometrial hyperplasia concerns that we have. So there's safer options. They do range with women. I often recommend probiotics for the genitourinary symptoms of menopause or UTIs. And one of the bottom right ones is my favorite because it's chock full of the lactobacillus different strain. We also are concerned for yeast infections, and boric acid suppositories are another helpful option here for women. So libido and Parkinson's, we want to discuss with women. These are some of my most favorite recommendations. We want to make sure to reduce pain, and this can be done through just first step would be organic lubricants, and then working with HRT. Estrogen plumps up this tissue. It aids by helping with the collagen production, as we were discussing. Helpful to prevent those UTIs before they begin. And D-mannose, again, is this preventative pathway. It's a sugar that's not absorbed, but then helps cling to the bacteria in the urethra. And estrogen and progesterone topically and as inserts can also be helpful. I use a product called Cranstat. That's often an uber earthy D-mannose cranberry blend. That's really helpful for women. But again, screening for urinary analysis, screening for infection first, and culturing. Often I really like to culture UTIs to see what we're up against, whether or not it's interstitial cystitis or a UTI is very important to know. DHEA can be used internally too as a patch or an oral. DHEA is also helpful, as we discussed a little bit, for insulin resistance. And unfortunately, insulin resistance happens often as we age and go through perimenopause. So I'm screening for the same contraindications again for estrogen and progesterone with HRT. Libido, we can use maca and mucuna. Mucuna has levodopa. I just did a presentation with more details on this botanical on mucuna, and it's traditionally used as an aphrodisiac. So a really interesting plant that has actually the precursor levodopa in it, as well as a whole profile of phytoconstituents that are often seen and helpful for some of the HPO pathways and increasing this sexual drive. Most of these are safe in Parkinson's treatment plans. However, I do want people to discuss with their care providers and making sure that they follow up with the specifics that are unique to them. And discussing mental health and estrogen, serotonin, and Parkinson's. During menopause, we have a drop in estrogen. We also have a drop in serotonin. So we're likely going to even see lower serotonin than the average woman in a Parkinson's diagnosis. Parkinson's patients have less dopamine. They often have less serotonin. I see this on what I call, it's a ZRT, it's a urinary test that I often use with patients. Women in this perimenopause area are likely to have less serotonin, which can then unfortunately lead to more mood fluctuations, depression, anxiety. So I really want to focus on supporting the biochemistry of the serotonin pathways for women, working with products such as CME, 5-HTP. We also don't want to take these supplements with antidepressants. We can risk serotonin syndrome, which is very serious. And NAC is potentially beneficial due to its role in anxiety. It helps regulate the release of glutamate, which is one of our excitatory neurotransmitters. Again, here's discussing with your physician, making sure for interactions. I've linked some of these supplements on the bottom of my website for quality control and analysis. I don't recommend Amazon because we want to be careful with sourcing and storage, making sure these products aren't left out in the sun. And heat degradation is a big important part because if you're going to pay for them, you want them to be quality. And now I like to discuss again, like these mood changes with women, the perimenopause, dopamine, serotonin, and estrogen, how these interact with each other. We need to address anxiety and depression. Dr. Haber discusses that menopause actually has the highest rate of suicide for females and the highest divorce rates. So how can we support this? I like to discuss support groups with women, therapists, exercise in the form of Tai Chi, yoga, things like acupuncture are incredibly helpful. Breath work, meditation, neurofeedback, biofeedback, things that you can do to stimulate the vagus nerve, which has to do with actually our parasympathetic nervous system, rest and digest that we talk about often. Unfortunately, loneliness is one of the predictors of Parkinson's progression. So making sure that you're not isolated and trying to make de-stressing and stress management a priority. The B complex is often deficient in Parkinson's patients, so I like to support methylation pathways. We want to use a methylated supplement. Always look for, on the back of your bottles, look for methylcobalamin, which is going to help support your homocysteine pathways. Magnesium, especially magnesium threonate, magnesium glycinate, are useful. I often avoid magnesium oxide in Parkinson's patients because there's research that shows that it interferes with levodopa plasma curve absorption. Magnesium oxide is often used in constipation, so is mag citrate. Citrate doesn't have these interactions. I use it, if we need to use it, I will increase vitamin C because vitamin C increases the plasma curve efficacy. So kind of balancing out that biochemistry in terms of helping levodopa become more available. Vitamin C is something that I often use with patients. Fish oil has a lot of really good research for depression and inflammation. So going high on omega-3s here, I often recommend people take fish oil twice per day. So like in the morning with their meal and at night with their meal. It's a fat soluble vitamin. So you want to take that with your vitamin D and food for best absorption. It can be helpful for depression, anxiety. I recommend a 4-gram minimum dosage. We want to screen here for blood thinners, and you can track this with your EPA DHA levels on your omega check on blood work, so that's available. Optimal omega-3 acid helps to promote hormonal balance because omega-3s have a role in healthy inflammatory responses. So we know inflammation can disrupt the normal health of sex hormones and balance and function. So these are some of my top supplement recommendations for anxiety. And we often use L-theanine as a chewable, like needed PRN, so as needed. GABA is a chewable. Glycine is a nice powder. Taurin's a nice powder. I often run the ZRT urinary test to track some of these metabolites and see what's low specifically for each person. I like to measure cortisol. I use the Dutch test or serum morning blood. The Dutch test is helpful because it has this diurnal cortisol curve, the CAR, the cortisol awakening response, which is about 4 to 5 times checking throughout the day and night. And then we get a better accurate representation of what cortisol is doing. I use Cortisol Manager often, which is one of my favorite products. It has magnolia bark, which helps optimize cortisol. It works with the HPA, the hypothalamic pituitary adrenal axis, which is great for the adrenals. I often recommend ashwagandha, which helps lower cortisol. It's also in the Cortisol Manager product. Some nervine herbs that I really like are lemon balm, valerian, passion flower, St. John's wort, lavender, and hops. Being very careful here to not mix anything with benzodiazepines or antidepressants. Always checking for interactions and supplement with your Medicare provider. Cardiovascular health and cholesterol unfortunately starts increasing in women's 30s and 40s. So homocysteine is an amino acid that's a byproduct of protein metabolism. When homocysteine levels are elevated, it damages the lining of the blood vessels and increases our risk for blood clots, leading to heart attacks, strokes, and other cardiovascular issues. Our goal for healthy homocysteine pathway is allowing the normal production of its end products, because it's an intermediate and is involved in the neurotransmitters of norepinephrine and dopamine. So an optional functioning homocysteine pathway provides our methyl and sulfur groups for biochemical reactions such as detoxification and methylation. When methylation's got a lot of attention lately, so we talk about homocysteine and MTHFR mutations. Some people have a genetic variant called the methyl tetrahydrofolate reductase, which impairs their ability to process folate. So this defective gene leads to elevated levels of homocysteine for some people that inherit this variant, and especially if it comes from both parents. I sometimes screen for this on labs, but I often just assume people have 1 or 2 variants, and then always recommend methylated forms of the B vitamins. I regularly screen for homocysteine in all my patients, especially women that are perimenopausal age and considering or on HRT. The estrobolome and how each woman metabolizes estrogen can differ. The estrogen bolome refers to a collection of the bacteria in the gut, which help metabolize and influence the different estrogen levels. It plays a role in enterohepatic circulation of estrogen, which is the process by which we excrete estrogen, and it's excreted into the gut, metabolized by these gut bacteria, and then reabsorbed back into the bloodstream, which we don't want. We want to detox it. The estrobolome's function can impact overall estrogen levels and can contribute to estrogen-related diseases and buildup. This is especially important in Parkinson's to understand which pathways are active. We know in Parkinson's patients, there is gut bacteria differences. Optimizing the GI is a really good place to start, and I work there often with people to support the estrogen and hormonal health. And I'll use the GI map and the Genova stool test to understand the microbiome, and then discuss the Dutch test with women. So we want to be seeing this 2OH pathway and not the 4 and the 16. So we work down here, and then we need all of our COMT and methylation pathways to be working as well. The estrogen bolome and estrogen metabolism. So estrogen undergoes several steps, and it needs to be metabolized and then excreted by the body. So we have primary estrogens. We talk about the estrone, estradiol, and estriol. And those need to be hydroxylated by CPY450 in the liver. And people can often have problems with those enzymes too. So we need to support those pathways. Those metabolites can undergo further metabolism, what we talked about with methylation, glucuronidation, sulfonation, into their conjugated forms. Estrogens are packed up and then they travel via the bile into the intestines for excretion. So we need our gallbladder to be hopefully present and working. And our things that are really supportive of this pathway: glycine, cruciferous vegetables, prebiotics such as things like onions, bananas, probiotics like kimchi, sauerkraut, healthy vegetables such as cruciferous veggies are great for these pathways for hormone support. Broccoli, cauliflower, the broccoli sprouts have sulforaphanes, which is great for liver health. We want detox of these hormones, focusing on some of these antioxidant supports of glutathione, which is helpful, and double hits on detox antioxidant support, like things like avocados, Brussels sprouts, beets, cabbage, spinach, parsley, green tea, mushrooms, which are a nice source of vitamin D, and wild salmon, which is a good source of omega-3s. In 1985, there was a specific bacterial strain that was identified and could produce an enzyme called beta-glucuronidase, which deconjugates estrogens and makes them more available to be reabsorbed back into the gut and back into circulation, which is actually problematic. So analyzing all of this on blood work is the first place I like to start with women, and then helpful to track and see how we can modify that, because we can push more towards these favorable pathways of this 2OH. We want the 2OH pathway for estrogen metabolism. If not detoxified properly, the 4 and the 16 combined, so over here on this side, and unfortunately make more damaging DNA for pro-breast health, like cancer pathways. Hormonal balance is important, so we can utilize herbs and supplements such as chaste tree, black cohosh, a lot of women have heard of. DIM is a product that can help promote the healthy 2OH pathway and proper estrogen absorption and elimination. Calcium and D-glucuronate, broccoli and mustard seeds are helpful in this estrogen removal process. Resveratrol, EGC from green tea can also help promote this antioxidant support. Magnesium and calcium help support bone health and hormone health, so making sure to focus on those in the diet. Again, Dutch testing is how we're understanding these pathways, and so we're not guessing what's happening biochemically. I like to discuss exposure risk, GPS, where people are living, where they have lived, and your estrogen disruptors. So how can we avoid plastics? How can we avoid chemicals and pesticides, especially paraquat, because paraquat's use has doubled, especially here in California in the past 5 years, unfortunately. We want to know where the fun sites are located at. This fantastic book, Ending Parkinson's. There's so many resources in here and maps of all of like where you live, where the chemicals are at, links to look up how clean your water is, the dirty dozen, which are the foods that are most often contaminated with pesticides and herbicides. And we want to make sure to screen for TCE, that for what sites that they're offered. It's often used in trichloroethylene is used in the dry cleaning industry. It's also used to decaffeinate coffee. These are all linked to Parkinson's. So as far away as we can get from these exposures, the better in terms of our diet and consumption. Eating fresh fruits and vegetables, but being aware of the dirty dozen list. So making sure to buy those ones organically. If cost is a limiting factor, just being very conscious of which ones that you're purchasing organic. Washing fruits and vegetables in vinegar and soapy water, because a lot of these pesticides are fat soluble. Limiting exposure from gluten and dairy, unfortunately, are both pretty inflammatory and linked to Parkinson's. So we try to obtain fats from lean meats, veggies, seeds, and nuts. Increasing avocados, which are high in glutathione, helpful for detox pathways that we were discussing. Coconut milk, coconut oil, the nuts. Walnuts also have glutathione. Chia seeds are a nice healthy source of selenium and fiber. Selenium is important for our thyroid gland. Fish oil is helpful. I was mentioning twice per day. Being really careful with quality control here again for mercury content. I like the brands like Nordic Natural, Barleans are some good ones that I trust. We are trying to support the mitochondria. Mitochondrial support and dopamine and menopause fatigue. So we want to limit our exposure and focus on the antioxidant profile of anthocyanins, which are dark berries and pomegranates. Vitamin C is really important here. We cannot, as humans, make this ourselves, so we need to support exogenously, and recommend that foods be high in like fresh fruits and veggies are high in vitamin C. Vitamin C also helps with the levodopa medication absorption. And NAC is a nice, helpful one along with glutathione. These are major precursors to the antioxidant pathway. CoQ10 is an important component of the electron transport chain and cellular energy production. I hear firsthand a lot of people benefit from NAD+ for energy production. This is one of the supplements my patients notice less fatigue upon supplementing, especially women. GI testing and constipation. I often run the GI map. We're screening for pathogens, H. pylori, especially in women, screening for these ferritin levels we're talking about in perimenopause, blastocystis and infections that are just low level lingering in the GI tract. I want to check either in like Genova, which is a 3-day stool sample. I like to see and track the short chain fatty acid production for each person, check on the GI inflammation load, and analyze the microbiome. If indicated, I'll run a SIBO or an IMO test. So that's checking for bacterial overgrowth for patients, and often could be yeast or candida related. So bacteria and yeast in the GI, which are unfortunately going to rob some of our nutrients, can cause some of this constipation, commonly seen in Parkinson's. So we're focusing on these 4 Rs: remove, replace, reinoculate, repair. And depending on if people do or don't have their gallbladder, we're going to focus on that health, especially in women, especially in Parkinson's, utilizing some of these ox bile pathways for hormone detox. In the perimenopause and menopause diet, we discuss things that are really an anti-inflammatory. We're addressing B12, folate, and vitamin D. We want to limit refined sugars, flours, carbs, remove ultra-processed foods always. Eliminate constipation. That's one of the very first things I work with people on is constipation. We're aiming for that daily bowel movement. Magnesium, QHS, so at bedtime, magnesium can be helpful. There's a tri-blend of magnesium that I like to use that has different forms of magnesium in it. Because magnesium, there's multiple forms, and they operate in different places throughout the body. The chia seed pudding can be really helpful. You just mix a couple tablespoons of chia seed in either coconut milk or almond milk. Good for, it has selenium, and then also helpful for fiber, constipation. It's mucilaginous, so it's actually healing to the GI tract as well. So nice high fiber content foods such as like apples that also aren't affecting blood glucose levels as much. So we're trying to avoid those spikes. Blue heron's one of my favorite supplements. It's a fiber blend, prebiotic blend, has marshmallow root, again, the mucilaginous, avocados, fiber, and glutathione. Recommending that women aim to get minimum 25 to 35 grams per day. Sometimes I like to say 45 is like a really nice goal. And we're going to lean in here on cruciferous veggies, the broccoli, the cauliflower, the broccoli sprouts, the sulforaphane, which are helpful for the liver detox and hormones, and especially for Parkinson's women. My patients, I like to potentially recommend intermittent fasting. It depends on what a person's weight looks like and how they're feeling metabolically. But essentially, it's helpful to eat between certain windows and 11 to 7 p.m. maybe, but it depends on people are waking up and depends on medications. So there's definitely not a one size fits all. This aids in the glymphatic system and autophagy. So the glymphatic system is essentially our lymphatic system of our brain, and it happens when we sleep. We need to take out the cellular trash and metabolic waste products. We want to focus on hydration being hugely important, hugely important. Essentially, your aim is to drink half your body weight in ounces per day. Incorporating electrolytes is a really good way to help prevent nocturia, so excessive nighttime urination. So you're trying to hydrate at a cellular level and not just being diuretically excreting all of your water, but actually helping it into the cells and preventing that constipation, helping to prevent the brain fog, the lightheadedness, especially helpful. We're not talking about sugary drinks or like things like Gatorade here. We want to be very specific with low sugar content. There are specific brands I recommend for electrolytes and those specific forms of the nutrients like potassium bicarbonate. Focusing on GI health and GLP-1, especially in women with Parkinson's and these insulin as we age, we are unfortunately headed towards more insulin resistance. So how can we prevent that from happening, and focusing on the gut microflora? So the species Akkermansia is often higher in the Parkinson's gut. I see this very commonly. It's now gained a lot of popularity in a lot of prebiotic, probiotic supplements that are on the market. So I see this potentially as a red flag. Having a high Akkermansia might be because it's a first responder for gut inflammation. The Akkermansia might be actually shedding into the bowels. It may not necessarily be high in Parkinson's, but it's that first responder being higher because it's triggered in GI inflammation processes, and it's a response. So it's a keystone strain for a healthy mucinin layer. We're going to focus here on the GI integrity and preventing of the leaky gut, which increases the immune reaction and histamine response. So essentially like making sure those cells have a nice tight junction. The Akkermansia is about a 1 to 4% of the actual healthy gut microbiome and lives in the mucosal layer. It can decrease by 90% as we age. And this bacteria strain thrives on polyphenols. Polyphenols, again, those dark berries. So one more reason to focus on berry consumption. It increases this butyrate production. So downstream, it helps to increase the short chain fatty acids, prebiotics, probiotics, and increases the short chain fatty acids. Those are often seen low in Parkinson's on GI reports. So this helps reduce the permeability through those tight junctions I was mentioning in the gut. Strengthens this gut barrier, stimulating this healthy mucus production, so helping push things through and not through the cells, causing an increase in histamine. We want to increase this GLP-1, this whole process increases the natural GLP-1 production that we want to see in the gut, and then a healthy insulin response. And focusing on sleep and sleep disruptors, sleep optimization, with women, especially blood sugar balances. So I often recommend women have a continuous glucose monitor for 2 weeks. We can just track some data over a week or two just to get some really helpful information. They're now available over the counter, which is fantastic. If you are experiencing hypoglycemia during bedtime or at night and you're having dips, that can also be a confounding factor with menopause, Parkinson's symptoms, or blood sugar imbalances. So differentiating their root cause. If you're having hypoglycemia, a nice like protein-rich snack right before bed, so an apple with some tablespoons of nut butter can be helpful. Working on hormone imbalances and HRT, discussing those with women. Progesterone is really helpful for sleep. DHEA can be helpful for sleep. It can be helpful in those vasomotor symptoms, such as hot flashes women experience with menopause. And due to the estrogen loss, the nocturia can be seen increasing. So that's a nighttime urination. So we're helping to onboard electrolytes during the day to help cellularly hydrate. So you're not just diuretic. And then trying to get your liquids in before like 3 or 4 p.m. So increasing your liquid load in the morning be helpful. We want to focus on breathing disorders. So focus in screening on sleep apnea, REM behavior, sleep disorder, reducing substances that can be stimulating, such as caffeine. It has a really long half-life, and some people metabolize it differently. So potentially keeping it either in the morning and not having an afternoon coffee. And green tea also has caffeine as well, and black tea. Removing alcohol and tobacco. Focusing on your stress and cortisol curve, so incorporating mindfulness, meditation exercises, especially before bed. So incorporating these right before that sleep can help induce a sleep cycle and de-stress. We want to have movement during the day, but working out too late at night can actually be stimulating to the body. So trying to keep the workouts in the middle part of the day. Focusing on environmental factors that we can control, such as the amount of light, the ambient lights in the bedroom, if our partner's snoring, we have animals, we're trying to minimize all those noises, trying to keep the temperature cooler, so 60 to 67 degrees, and focusing things like that might be causing discomfort due to gravity. So lying back also unfortunately increases people's heartburn. So propping up pillows, there's great products like DGL, delacerated licorice root, and esophageal guardian, which is like an algae that forms this nice barrier that helps with preventing any GERD, so heartburn. Focusing on things for back pain, like Epsom salt baths at night can be really helpful. They also can be helpful for fatigue and sore muscles. Restless legs can be really helped by magnesium Epsom salt baths. If people are under medicated, you want to focus on increasing a little bit of Cinemet, the controlled release at bedtime, supporting the natural processes of our antioxidant hormones, which is the melatonin pathway, the diurnal, the opposite of the cortisol. Often we see people benefit from melatonin use, either immediate release or controlled release, or both, actually. And a good way is wearables and metrics like Aura rings help track our HRV, which is some helpful information to know what's helping or inhibiting our sleep, and how our patterns throughout the day or what we ate or drank can then in fact affect our sleep and how much deep sleep we're getting. Its research suggests that exposure to bright sunlight in the morning is really helpful. So those actually the first 4 minutes of when you wake up. You want to either go outside, or if you're not in a sunny place, sun lamps are a really good alternative if you live in a dark climate. We want to focus on estrogen loss here because of the osteoporosis connection for women. This is really, really important because the lack of estrogen can lead to really strange diagnoses, things like frozen shoulder diagnosis and joint and muscle pain. So like I was saying, we have estrogen receptors all over our body. So bone health and hormones and estrogen are very important to protect here to prevent osteoporosis. Focusing on lab work. So the first thing you do is get a vitamin D lab on people and screen for that level. We can then supplement vitamin D, K1, K2. This is one of my favorite ones. I've seen take people from like a 17 or 12 all the way overshoot. So you don't want to go too high either because vitamin D is fat soluble. So a nice mid-range number, potentially around 40 to 60. calcium goal here. So we do want to focus on calcium. Calcium is really important to get in dietarily. So as much as you can get from the diet, 19 cups of kale. So that's an overshoot, but things that you can do to hack that. So like steaming kale is a really good way to condense kale, putting in the oven. Dark leafy greens are a nice source of calcium. Because we do recommend people avoid dairy often in Parkinson's diagnosis, because we know dairy is pro-inflammatory. So how can you get calcium through the diet is often in plants. And between supplement and diet, we're aiming for 1,200 milligrams of calcium per day. Focusing on fall prevention and bone health is really important, especially in Parkinson's diagnosis. So I like to discuss weight-bearing exercises. It's been shown to prevent osteoporosis, so putting the weight on the axial spine, actually. So those are the weighted vests, 8 to 12 pounds, about 10% of your body weight is the goal. They can be worn when you're out walking, running errands, worn during, like leg days in the gym, but focusing on keeping those weighted vests, especially for women, keeping the weight on the axial spine. Vibratory masks, which are increasing the osteoblast activity, and estrogen and HRT discussion with primary care or gynecology is also helpful here for preventing bone loss. And lastly, I just like to throw in mention to periodontal health and menopause and Parkinson's in all women, that we need to focus on just taking care of our teeth, because teeth and gums can be a hidden trigger for inflammation. We often see an HSCRP really high in people, and it's because of gum health or dental work or things like brewing infections. So making sure to take care of your oral hygiene, it's important because we know that digestion begins in the mouth. It's important because it is a direct access to your brain, and we want to protect our gums from inflammation. So oil pulling with coconut oil and CoQ10, one of my favorite products, like the bottom right, has all of those in there. And coconut oil is antimicrobial, and the CoQ10 helps reduce that inflammatory load. So just taking care of gum health as we age can help decrease total body inflammation as well. Things that I like to discuss with patients, neuroplasticity. So neuroplasticity is the ability for your brain to change, and we want to cultivate this in a positive way. So encouraging positive feedback loops and a positive mindset. Some of my favorite resources are the book, The Joy of Living by Yungay Mingyur Rinpoche. He's a Tibetan monk that works with the University of Madison, Wisconsin. So there's some really great work that's been going on at the University of Madison for neuroplasticity and incorporating Tibetan Buddhism and how we can work on the science of happiness, essentially. How to Befriend Your Stress is a great TED Talk. Getting connection through prayer, church, community, things where people gather, Parkinson's support groups. Tong Lun, so the practice of gratitude. Gratitude has been shown over and over again to be almost as beneficial as taking antidepressants. So even just like getting a gratitude journal and writing 3 things before bed that you're grateful for can help shift that neuroplasticity. We're looking for new positive neuronal connections, and that has to be done through positive intention. And they even have studies that were done by Olympic training and research where if like you go there in the mind, you can go there in the body. So when I was trained in gymnastics, we'd look at these little pictures of girls doing backflips on the balance beam, and that's essentially how we taught ourselves to do these things. And they've done studies where the same neuronal synapses fire in the same sequences. So biohacking these things now with essentially biofeedback and neurofeedback. So how can we train our systems to be more stress resistant? And recap, so HRT in Parkinson's is generally considered safe and effective, usually and like mostly with all Parkinson's, levodopa, carbidopa medications. There are research unfortunately sparse in this area. Like it's been a while just getting research in menopause and perimenopause and then extrapolate that to Parkinson's specific. So we do see that hormone replacement can help reduce the severity of motor symptoms. It's usually safe and effective, and with all Parkinson's medications. There's a great New York Times article that just came out last week advocating for HRT safety. So I recommend, it's like a 6-minute read. It's fantastic. Right now, there is no conclusive evidence that HRT prevents or delays Parkinson's for women, But again, I don't think the research is very conclusive here. So I kind of advocate for these things for women and always screen first for the major interactions that we discussed earlier. And we see estrogen and HRT and then levodopa. Research is limited, but it can be safely used alongside most Parkinson's medications. Estrogen has been linked to several potential benefits in Parkinson's, including improved motor symptoms. And some studies suggest estrogen can reduce the severity of motor symptoms, especially in early Parkinson's, and been shown to reduce dyskinesia. So research suggests estrogen may be protective of the nigrostriatal pathway and maybe even helping with this dopamine synthesis, metabolism, and transport. My recommendation is for people to always track and document your menses and your Parkinson's symptoms for 3 months at least. And then you can kind of help your provider, help you distinguish what's Parkinson's and what's peri or menopause related. And again, discuss with your neurologist for hormonal support always and guidance for very specifics here on what works for you. And just thank you for your time today. My contact information is listed, and some of the supplements, again, we've linked those for safety and quality control. And today I'd like to just open up to any questions.
Tanya, thank you so much. This has been really loaded with loads of information. I think some of us will need to digest this a few times. There was one comment at the start that some of the information were quite complex to understand. So what we could do tomorrow, I will go through the transcript and write an article, a blog, a little bit in a simplified English, and with the help of that, Tanya, we can distribute again. That's okay.
Yeah, I was gonna say I could answer like the top kind of the 10 questions and like be very specific, but I'd love to give like the information, the slides, the research, and then how to make that digestible.
Fantastic. We have a couple of questions from Kati. If you can open the Q&A questions, please. If you have any other questions, ask now here in the Q&A. Is tea with valerian root okay to drink every night to help with sleep and sleep time extra?
Yeah, the Sleepy Time Extra Tea has valerian in it. It can be helpful. You always want to screen your medications with your provider to see any interactions always. But as a general rule of thumb, valerian is one of our stronger nervines, and sedatives. So should be helpful for sleeping time. It can be used long term, but again, making sure to check with all of your other medications that you're taking with your provider to screen for interactions. And always checking for liver health too, to make sure that the liver can process and metabolize a lot of the load that you're taking of medications and combined with supplements. So checking for liver enzymes. But generally, valerian tea is okay to take.
And one more question from Kathy. What do you think about the PS128 probiotics? Yes, we heard this quite a few times. That's supposed to help with PD.
Is that the 4-strain brand that I had on there, the 128 on there that we're talking about? There's a lot of the gut. So each person, I like to see their gut microbiome. Surprisingly, when I think people might be high or low in one strain, they may not be. So it's hard for me to give a blanket recommendation for probiotics. But I like to see the gut microflora. But generally eating like food source probiotics, so kimchi, fermented foods, that could be helpful. And if you're seeing people are generally responding well, then that would be something safer. TIS probiotics are on the safer kind of low interaction profile list.
I've noticed you have shown a few times on your slides Simproof, which is here available in the UK. Do you also source this in the US already?
People see some good response with that. So I see people internationally. So that's something, I don't know if they can specifically get that one in the US. The ones that I recommend in the US are more of the Pendulum brand for accessibility. But I'm open to seeing what works for them and then tracking that. But it's really kind of good to start with the baseline and what's in the gut already, and then trying to help guide that through dietary choices and then increasing the things that we're talking about too, like getting the short chain fatty acids and the butyrate. The best thing you can do is actually eat 30 different variety of foods per week in terms of fruits and vegetables, which is going to help increase the probiotic content of the gut naturally.
Fantastic. We do like the Simproof is we use it quite a lot. And just for anyone here in the UK who is listening to us, Simproof is doing a lot of studies, quite a bit of studies with Parkinson's, and you can get with Parkinson's UK number, you can get 20% discount. I don't have anything from them. It's just we are using it, so I thought I'd share it with everyone. There is a question. I know constipation is common in 90% of people with PD. However, I am not one of those people. I have several bowel movements a day typical and feel I am not getting proper minerals because food doesn't stay in my stomach long enough. What test should I consider for this? Also, I often feel my blood glucose dips in the middle of the night. What test should I do also for this?
Yeah, I'll work backwards on the question. So the last one for blood glucose drops, so hypoglycemia, when we have too low blood sugar, so potentially if you're going under 70, things that help are the continuous blood glucose monitor. So those are available over the counter now. You can put them on your arm and track for a week. You can use your phone, and it helps give you live feedback, which is really, really helpful because you can see what foods that are eating are affecting your blood sugars. And that's real time. And it also can help wake you up at night if you're having a hypoglycemia. And so glucose tabs are one way to help. That high protein snack before bed, so a little bit of almond or nut butter. Having almonds around can be helpful. Checking your fasting blood glucose in the morning. So a fasting blood glucose would be your more immediate analysis of what your blood looks like. And then an A1C can be helpful for checking your 3-month glucose average. Your fasting insulin would also be another test to check for blood glucose. And then we were talking about, the continuous glucose monitors kind of feel like your best way to get real-time answers. You can even buy like the finger prick stick ones over the counter too and check them yourself for blood glucose. And then let's see here. The other question was about minerals, like more like loose stools and constipation. Yeah, I have it's more often seen that we have constipation or early satiety in Parkinson's, but I do have people who have what is called dumping disorders. So where the contents of the GI are actually emptying too quickly. And so the food isn't necessarily being digested and absorbed as well as you would like to see, which is kind of I think to your point about worrying about mineral consumption. So they were working on actually slowing transit time. So the things that blue heron supplement, I like to see working with people, recommending that, like not necessarily at the same time you're taking your Parkinson's medications, but I use that one either at night with people, and that has these mucilaginous herbs and a nice fiber supply. So it has acacia fiber in it, which I really like to use with people, and it's a bulking agent. So it helps slow down the transit through the gut. So that would give time for your body to pull out more of those nutrient minerals. So those are some of my favorite.
Okay, thank you so much. Just a question about Simproof. That's the very popular probiotic here in the UK. With people with Parkinson's, they do a lot of research, which we are following and will be publishing on PD Body definitely. And what I was saying, probably too fast. If you have a Parkinson's UK number, you can just submit to them and obtain 20% discount. I think that's all the questions we have from the audience for you, Tanya. But I know you are available for any other questions one-to-one, and I'll also help with all those tests you have mentioned.
Perfect.
All right. Well, thank you everyone for joining our session. Very specific and niche, and next month On the 12th of May, your favorite host, Michelle, will be back and with interviewing Professor Malu Tansi about inflammation and Parkinson's and what we can do about it. Well, thank you, Tanya, so much for sharing with us all the information, and we will turn this into an interesting article, a little bit in simplifying. And once again, if you have any questions, Tanya, reach out to her directly. Thank you so much.
Thank you.